So I do want to talk about some of the cosmetic dermatology issues, and something we see very commonly in the office and get requests for all the time is information about laser hair removal. How does that even work? Who should get it? Who shouldn't get it?
Everyone with dark hair should consider it. The way that laser hair removal works is basically the laser targets dark hair because the laser sees the melanin in your hair and it basically targets it and blows it away. So we have lots of different lasers available now because if you have darker skin, this laser will see your hair, but it will also see your skin. So we use special types of lasers depending on your skin color to make sure to try and target the hair and not the skin and discolor the skin. I think it's really beneficial for, the armpits and the groin area, especially for people who are prone to ingrown hairs and, cysts. And there's also a condition, hidradenitis suppurativa, which I see a lot. I imagine you as gynecologists would also see that a lot too. And
Oh, we
one
sure
of
do.
the applications is laser hair removal as well.
So it targets the melanin in the hair follicle, but does it also target the melanin in the skin? So if you have dark skin, what happens when you do laser hair removal?
We do have lasers that are more longer wavelengths, which can penetrate the skin deeper and protect the surface of the skin. That one we'll use on darker skin patients for laser hair removal. We do have to be just more careful. So a lot of times we'll have to start lower. In medicine, they say go low and slow. So a lot of times we'll do that. So if you are a patient who has darker skin, you may, require a few more sessions just because we might need to go slower with that.
I noticed there's a lot of people out there giving Botox. What happens when somebody goes to get Botox with somebody who's not a professional and they put it in the wrong place or they put too much of it in? What could happen there, and how do you prevent that?
The attention to detail and the way that you understand facial anatomy and facial structure. And I think that board certified dermatologists and board certified plastic surgeons, spend their career studying facial anatomy and facial structure. And so no one's going to know it better than them. So, the way that we tweak the muscle and we put a little bit of Botox here, a little bit there, I think is really can alter your face. This is your face we're talking about. So to me, it's not just Botox, because if your eyebrow position is now out of position for the next 3 months, that's not how you want to look at yourself in the mirror, for the next 3 months. So I think that, it's important to go whoever, nurse, NP, PA, or MD, whoever you go to for any of these things, it's important to trust them and to know that they know their anatomy and that they come from a reputable place.